This patient actually died on the operating table. Michael McClure, a 60-year-old Port Orange resident, thought he was healthy until sudden symptoms like heartburn, exhaustion, and indigestion brought him to the emergency department. Let's hear Michael's story now. Now let me ask you, you had something that really a lot of people share with you, and unfortunately will continue to share, and that's having a heart attack. And can you tell me what led up to that heart attack? What were you doing? What happened?
I just felt like I had a little indigestion, and possibly a little heartburn. And I'm not one that has stomach problems at all, so I thought Sunday night that it could be something other than just your stomach. So I took 2 aspirins before I went to bed. I got up and went to work on a Monday morning, and about 9 o'clock in the morning, the pain became severe. It was a deep feeling, not like a shallow feeling. It was a deep feeling in my chest. I went out to my car. I sat in my truck, turned on the air conditioner to kind of get rid of the sweats that I had. I got 2 aspirin, and I took those 2 aspirin. I called a fellow worker over, and I said to him, I said, Gary, if I feel better in about 30 minutes, I want you to take me to the hospital. I think I'm having a heart attack. And I said, if I pass out, I want you to call 911. But at that time, I thought better of it, and I said, go ahead and call 911. They took me in the ambulance, and as I arrived, they took me directly into the emergency room. When I told my wife that I was having a heart attack, she just about went down on the floor. It was just a few minutes then when I told her I loved her. I gave her a kiss. I hugged my son, and I told him, get back there and take care of your daughter. They started to wheel me down to the cath lab, and Dr. Jamadar said, well, I'm Dr. Jamadar. We're going to take you down there and find out what's wrong. They got me to the cath lab, and they said, now we're going to work down in your groin area here. We'll do a little shaving, and then we're going to stick the catheter in and find out what's going on. And I said, okay. I had a little bit of anxiety coming on at that time. When they laid me out on the table, they kind of spread your arms out and had a young lady on this left-hand side and a young man on this right-hand side. And the young man and I started to carry on the conversation while they started to prep me. I felt the catheter go in. It was cold, and I said, wow, that thing's cold. He says, it'll be fine in just a minute. He says, but I'm Dr. Jamadar. I'm going to go in, find out what's wrong, and I'm going to fix it. And I laid back and said, well, let's rock. It didn't take too long before I could feel it, like I say, start into me. I just remember that when they hit me with the paddles the first time, that my heart was dead, but my head wasn't. And I screamed, and I threw a bunch of people off me. I later heard it was possibly 12 people that I threw off. I bruised my forearm, I bit my tongue, and bruised my arm as I did it. I felt the second hit, and I felt the third hit, and then I was very peaceful. I don't know how long I was gone. Some people ask me about that, you know, when you're gone, what it's like. And to me, it was very peaceful. I was reciting the 23rd Psalm in my head, and it wasn't like it was bright, but it was like when you close your eyes, you always see something. It was light. I felt very, very bright, very warm, very, very safe. And I don't know how long I was gone, but they did hit me 14 times with those paddles. They burnt the hair off of my chest and under my arm. I do remember waking up, and when I woke up, the first thing they said was, ow, how many of those stitches you're going to pull in? And that's where they put the sheath in my other leg to put a heart pump in to give my heart a chance to work through this trauma. Sometime during the episode, and it was finished, Dr. Jamadar came to the waiting room and told my son and my wife that I'd had a massive heart attack, that I was 100% clogged, and now I was 100% clear. And my son said, that doesn't make any sense. And he says, well, when we stuck the catheter in, we broke something off, a piece of plaque, and it plugged him up 100%. And I guess you heard the respiratory alert. He was in severe trauma, and he's back again. And Tim says, well, what do you mean he's 100% clear? So we got a heart pump working to help clear him and clear him out. So through the grace of God and His hand of having that team there, it really saved my life. I stayed there till Tuesday, and then they moved me down Tuesday night or Wednesday morning. It was Tuesday night, down to the second floor. The second floor is where the cath lab is. So I got up early in the morning and I walked down to the corner of my room, looked down the hall, and I looked down the end of the hall, and there was a girl going to work in the cath lab that saved my life. When I saw her, I said, "I hope I didn't hurt you." And she said, "You threw me across the room and you weren't even alive." And so I said, "Well, I'm sorry, I hope it didn't hurt you, but I just want to thank you for saving my life." The things that Dr. Jamadar told me, says, if you would not have taken those 2 aspirin, you probably wouldn't have made it here.
What made you take the 2 aspirin? Did you just do it on your own, or did somebody tell you?
Well, you know, you see the ads on TV all the time, and you know that aspirin, well, I do know that the aspirin thins the blood and helps promote circulation. Don't dismiss it. If you feel like you have indigestion or a deep feeling, or your arm radiates and it seems like it's going to your heart, or you just don't feel right, don't dismiss it. Get somebody to look at it. Get somebody to check it right away, because it, especially if you've had heart disease in your family. And my dad had died at age 58 of a massive heart attack. And I had another friend tell me that when he went to the emergency room one time, he says, we've had a few people come in with Pepto-Bismol, still pink around their mouth where they thought they were having indigestion, and it turned out to be a heart problem.
All your years of life, you've been pretty active, right? And
yes,
sports and something. So I think it'd be interesting to hear you describe, we were talking about this earlier, that you get sore muscles from running too much or too quick, or playing sports or baseball or tennis or softball or whatever, and the pain that you had from your chest that you talk about that radiated, how would you describe that pain compared to just a muscle soreness? What was it like?
Yeah, that's a very important thing, that as an athlete, you know that if you bruise yourself or if you pull a muscle, it feels like it's on the surface. It doesn't feel like it's deep inside you. There's only one cardio muscle in your body, and that's your heart, and it will let you know a different way. It'll be a different feeling. But don't dismiss it, even if it's a little one, because I've done a lot of things that I've had a lot of pain playing sports, turning an ankle, sitting at home in ice all night long, so you didn't want to go to the emergency room. You wait to go see the orthopedic guy. It only felt like a 2 in comparison to a 1 to 10 ratio, so it wasn't like it was a severe pain.
Now, obviously, many people, especially in the United States, suffer heart attacks. A lot of people, unfortunately, don't make it. Why do you think you did? Why do you think you survived? Have you ever reflected back on that?
Yeah, I certainly have. Like I said earlier, Dr. Jamadar pointed out the aspirin, and we expanded upon that. If I'd have been more than an hour away from the hospital, I probably wouldn't be here. If that piece of plaque would have broke free at any other time, except during the time that they put that catheter in me, I wouldn't be here. They wouldn't have been able to bring me back. My wife calls me Lazarus now. But it's the grace of God and the teamwork of those people that God gave them the gift of the healing that they did in that cath lab, and the dedication to what they did, not to give up on me. I've been heard that 3 or 4 hits of the paddle is all they usually give a person, and yet they hung with me to bring me back to life.
It's an amazing story. Last question. Do you have to do anything different now? Do you have to alter your lifestyle with certain medications, with exercise, with certain diet? Are you aware of that you have to do something different, or are you able to continue on as you were before, playing sports and pretty much going back to the way it was before the heart attack?
I haven't slowed down a bit.
And I'm sure you look at every day when that sun comes up and just feel glad to be alive, glad to be able to participate in life and with your family and enjoy many years ahead.
I thank you, and yes, I do. It's just rewarding to know that there are people out there with the training that can handle a situation like that and make it work.